now joining us, we have Dr. David Linzey, and he is here to talk with us a little bit about pet dental care. And this is a topic that I feel like we kind of sweep under the rug and don't necessarily think about, but our pets need to take care of their teeth too.
Sure. It's actually been swept under the rug for a long, long time, and I would say that one of the reasons talking about it today, our clinic has kind of a special that we try to tend to highlight every month, and February this year is going to be Dental Health Month. So dental health in our pets has come a very, very long way, even in the last, I've been practicing for 20 years now, so I would say even in the last 5 to 10 years, there's really been a dramatic shift in the interest in maintaining our pets' dental care. Many, many years ago, basically just having your pet eat milk bones and chew on crunchy types of foods was basically the main way that we maintain their health. Nowadays, many clinics like mine are set up very similar to the dentist that you go to for your tooth care. And a lot of the instrumentation and the equipment and x-rays and all those are almost identical. So we've really come a long way, especially, like I said, in the last several years, really paying attention to dental health and dental care, because we realize that a lot of the same problems that people have when they don't take care of their teeth, dogs and cats both do as well. Plus, dogs in particular tend to have that annoying problem of chewing on things, and yes, many times those things are very hard and crunchy objects, and you can get tooth damage and cracks and chips and things like that that happen as a result of that.
So what are some tips that we need to look for to know that maybe our animals have got some dental problems?
Well, they say that probably 70+% of every dog and cat has some degree of dental disease, and I think the number is probably even higher than that. But the main complaint we get from owners coming in is that their pets' breath is terrible, and that's very common. I think probably more so dogs than cats, just because dogs tend to be in our faces a little bit more, especially little lap dogs. But that's the number one. The number one complaint is that they'll be in for an annual exam, vaccinations, and how's your pet doing? Fine, but the breath is just terrible. So, and I would say 99.9% of that problem is tooth or gum related. So, okay. And usually it's just a matter of a number of years of that dog tartar and things like that accumulating during that dog's lifetime and getting to a certain point where it's just starting to really cause a problem. And I have to think that it's not very pleasant for the dogs either. If owners are complaining about that, then I'm sure it's probably an issue for the pet as well. So.
Right. So now, chips in the teeth, does that cause them to be in pain? I mean, sometimes it will hurt us.
Well, we never really thought that a lot of times, because up until recent years we haven't really had the capability of doing dental x-rays, which they do with all of us when we go to the dentist. But that is something that really has grown recently in the last couple of years, and we've learned that the majority of the dental disease that may be going on is actually under the gum line, and we can't see it when we just look in the dog's mouth. So most people, when they decide that their pet needs to have its teeth cleaned, are using the amount of the tartar and the plaque and things like that that are adhered to the teeth as an indicator that they think something needs to be done. And that is the case, but as we're finding, there's a lot more going on in the tooth root and everything that we didn't realize and that you can't really see externally. So dogs for years, including some of my own, have had basically chipped teeth or fractured, or what are called slab fractures, where the pulp or the actual inside part of the tooth is visible from the outside. Doesn't seem to bother them at all, but when we do x-rays of these guys and look at the actual tooth root, we find that most of those actually are infected and abscessed. So whether dogs have a higher pain tolerance for that, I don't know, but they don't oftentimes have any sort of outward indication that there's any discomfort. But I have to think there is, and we can kind of confirm that, because when we do usually extract those teeth, because there's not a whole lot you can do at that point when they're infected other than remove them, but they seem to feel a whole lot better afterwards. So it's kind of one of those processes. It's very slow to come on, and it happens over a very long period of time, and I think they just kind of get used to it. But then when the problem is taken care of and the pain and the discomfort that's associated with that goes away, they seem to feel a whole lot better. So I think years ago, now I feel bad about having my own pet have a little slab fracture tooth, which I didn't think was a problem because she wouldn't tell us there was anything wrong.
Right.
But now after the fact, probably wish that we had maybe gone back and extracted those teeth at the time. Probably would have been a lot more comfortable for her as she got older. So.
Right.
But
Now, is it important, how often, I know my mom is on me, I need to go every 6 months to the dentist. Is it important for your dog to go that often, or?
Well, that's one of the things we check when they're in for their annual visit. We usually encourage folks to bring their pets in once a year for just an annual exam, and that's usually when they get their vaccinations and heartworm checks and those kind of things done. So we usually check the teeth at that time, and then it's kind of a judgment call as far as a lot of it depends on their age. There's very few 1 to 2 year old dogs that really have a lot of dental disease, but as they get to be 4, 5, 6 years old and older, usually it's much more of a common finding. So every dog's a little bit different, just like people are as far as the health of their teeth. But we usually try to check them at least once a year and then make recommendations based on that. Certain breeds have a reputation for having much more of a problem with dental disease than others. So little small breed dogs oftentimes are ones that tend to have more issues. But
Okay.
so.
Okay. So when you bring your dog in or your pet in to get their teeth cleaned, is it a quick process, or is it something they drop them off and then pick them up later?
They usually drop them off for the day. We schedule them like we do surgeries. So you bring them in the morning, and we do whatever preoperative work we're going to do, because it does require that they be sedated and under basically general anesthesia for a period of time. And the length of time depends on how much work actually needs to be done. And to just do a straight scaling and the quick dental x-rays to make sure there's nothing else that needs to be done, it's a fairly short procedure. We do get some animals that come in that have the majority of their teeth are not healthy, and at that point the owners need to decide whether they want to go ahead and do the extractions or not. And the extractions are usually something that we talk about doing, and sometimes in dogs with many teeth that are coming out, that can be a long procedure, sometimes even several hours. But we feel like it's better to probably go ahead and do all of it all at once and get it over with, than to have them come back repeatedly to kind of undergo the anesthesia multiple times. And that's something that a lot of people are nervous about, is the sedation part, and they really wish that they don't have to be sedated when they go to the doctor most of the time, but kind of wish that it could be done with them awake, but it's just not possible to do that with pets that won't sit still. The scaling part's not really painful, but they do need to be still, and then certainly if there's any sort of extractions and other sort of oral surgery things that need to be done, they would need to be sedated for that. So most of the time it's an outpatient procedure. They go home in the afternoons. Every once in a while, if we have some extensive stuff going on, they'll spend the night and then go home the next day. But we hope that they're better off for it afterwards. So
it's a pretty easy process.
it is.
Okay.
Now, as far as picking out different chew toys and keeping your pets from chewing furniture and things like that, what are kind of some guidelines to protect their teeth?
Yeah, usually the crunchy foods are usually better because they're a little bit more abrasive, and when they crunch on those the food, it kind of helps scrape some of that accumulated tartar off the teeth. Softer foods tend to be a little worse as far as being more adherent and kind of sticking to the teeth. So, and then there are all kinds of different chew toys and things. I've recently taken real bones away from my dog because she will chew on them with her molars, and it just almost sounds like she's cracking her teeth, and she has on a couple of them. So the really, really hard stuff is usually the more problematic as far as causing tooth damage. And other kind of crunchy sort of foods are a little bit better. And there are some dogs and some owners that actually have their teeth brushed. So, and that's something that is encouraged, but I would say that a lot of dogs and most cats probably don't tolerate that very well. And only your most dedicated owners are going to do that, although there's certainly no question that would help. I mean, we all brush our teeth, so hopefully the same sort of brushing action and those kind of things with different ingredients in the toothpaste and things like that would probably help as far as maintaining their health too. So, but that's just something else that some folks decide they want to try.
Yeah.
We tried doing that. I tried brushing my dog's teeth one time, and they kept chewing on the toothbrush,
Yeah.
so I just gave up.
Yeah, there's so many things that can go wrong with that. It's not for everyone, but if you can, and we encourage people to start them as puppies and kittens, and if they kind of get used to it, there's flavored toothpastes, not like mint, but more like chicken and beef and
Yeah,
things.
there you go.
And makes it tolerate a little bit better. But so those are things you can start when they're younger. They tend to tolerate it better as they get older. So
Well, mine didn't, but
Yeah.
they're just
it's worth trying.
Yeah.
So we've learned a lot today about how our pets need a lot of the same things we do when it comes to our teeth, even brushing their teeth. I don't know if I would try to brush my dog's teeth. That might be a little scary. But definitely something to maybe try at least once. Thank you so much for coming
Sure.
in to talk with us today.
Great. Thanks for having me.
Absolutely. And we will be back right after these messages with more of the Mountain Television Network.